Hello, everyone, and welcome. We're going to give folks a few seconds to migrate in from the waiting room. Good morning. We're just going to give a few more seconds and then we'll get started. Good morning. Welcome to Wellness, Your Employees and Your Business. I'm Amy Music, Coordinator of Strategic Partnerships for the New Jersey Business and Industry Association. With us today is Karen Hepp. Karen joined Delta Dental in October 2016 as Small Group Market Director. Today, Karen serves as Delta Dental's Assistant Vice President of Small Group and Individual Broker Channel Sales. Karen brings over 20 years of experience as a sales professional with key skill sets, including strategic account and personnel management, dynamic communication skills to establish and maintain key client relationships, and leading highly effective teams that deliver outstanding results with expertise and professionalism. A few housekeeping matters before we get started. Today's program is being recorded and will be emailed to you by the middle of next week. Please take a moment to change your view from gallery to speaker. This will help you engage with the presentation in the best possible way. If you're not sure how to do that, move your mouse to the upper right corner and click that button that says view, then select speaker. We'll also put some direction in the chat for you. I'd also like to draw your attention to the chat box. Karen would be happy to take the questions at the end, so just put them in the chat box as they come to you. If you have any trouble viewing or hearing during this presentation, don't forget you will automatically be receiving a recording. So if you have to sign out, you can rewatch the recording. So now, without further ado, Karen, take us away.
Thanks, Amy. Good morning and welcome. As Amy mentioned, I'm Karen Hepp. I'm Assistant Vice President of Small Group and Individual Broker Channel Sales with Delta Dental of New Jersey. I am happy to be here with you today to talk about a subject that's near and dear to me, which is the value of dental and vision benefits. I'd also like to thank you for being here this morning to attend what I hope you will find to be an informative and interesting webinar. As Amy mentioned, please ask your questions in the chat feature of Zoom throughout the presentation, as I want you to forget any of your questions, and I'll do my best to answer as many as possible, as we'll have a Q&A session allotted at the end of the webinar. So at the close of today's webinar, you will have learned that dental and vision care is more than just your teeth and eyes, how overall health is impacted by your oral and vision health, how having access to benefits encourages routine care, some of the socioeconomic costs of poor oral hygiene, the impacts of regular dental care on healthcare costs, what to consider when shopping for a dental and vision benefit for yourself or your employees, and what's in it for you. You'll have a better understanding of why employer-sponsored dental and vision benefits are so important. I'm going to be talking today about a lot of data, some statistics, and a lot of facts. And the point of sharing all of this is that it's important to consumers, employees, and their families. You'll hear me talk about information that pertains to you if you are responsible for employee benefits, but this will help you get into the minds of your employees and understand why these benefits are so important. What you'll hear is more than just statistics, and my hope is that this is what you will take away from today's webinar. So again, I'd like to thank you for being here with me today, and let's get started. You're going to hear me talk a lot about preventive care today. And even before the pandemic, employers understood the importance of ensuring a healthy employee base and the direct correlation to productivity. While healthcare benefits packages, including vision and dental benefits, always were a strategic component of employee recruitment, the C-suite has also realized the critical role those benefits play in maintaining a healthy workforce. Yet the true benefit has been the preventive aspects of such healthcare programs. It's no surprise that access to care increases the likelihood that individuals will utilize that care. So the coverage afforded through health plans encourages more proactive wellness. This allows for earlier detection of diseases, which you'll hear me talk a lot about today, and potential illnesses before they become critical health concerns. So what may be well less known is the vital role that oral health plays in that preventive care. So according to Delta Dental of New Jersey, research has shown there is a direct correlation between oral health and overall health. Poor oral health can lead to poor overall health. However, it is also true that poor oral health can be an indication that individuals are at risk or already suffer from other major diseases. Preventive oral care, which includes such things as simple checkups and exams by your dentist to regular treatments to support healthier gums, is a critical part of the prevention process and in maintaining strong oral health, but it is also important to your overall health. More and more reports during the past 5 years have underscored that correlation. In fact, 4 years ago, Healthy People 2030, this is the federal government's prevention agenda for building a healthier nation, identified oral health as one of the 10 leading indicators. Delta Dental of New Jersey circulated a study in New Jersey early last year in 2022 that was conducted by the University of Colorado School of Dental Medicine. The report found that increasing communication between dental and medical providers reduces barriers to care. According to the study, medical dental integration, MDI, improves positive health outcomes in vulnerable populations such as at-risk children, pregnant women, seniors, and those in need of chronic disease management. Essentially, that report underscored a fact that we've experienced firsthand in New Jersey for more than 50 years. That's how long Delta Dental of New Jersey has operated, that oral health and overall health, physical health, are inextricably linked. Our oral care is a critical component to overall wellness, and this is especially true for at-risk populations. So what are the benefits of an oral health examination? Well, in addition to the obvious, your mouth feels cleaner when you leave the dentist and is healthier after cleaning, getting rid of all that tartar and plaque. An oral health examination can reveal more than 120 conditions, including osteoporosis and Alzheimer's, and diabetes through A1C testing. And I will mention that Delta Dental was the first to promote making this test available in the dentist office. Other conditions such as oral cancer, anemia, GERD or acid reflux, plus conditions like gum disease have been linked with other chronic health problems such as heart disease, kidney disease, stroke, and pregnancy complications. So early detection makes a difference. In oral and visual care, which I'm going to talk about later on in the presentation, there's a potential to either prevent a condition from worsening or from catching something in the early stages. Preventing an associated medical condition from worsening lowers the need for aggressive treatment, high prescription costs, or anxious hours in the emergency room or urgent care centers. And this is all while reducing needless discomfort. So what's the socioeconomic cost of poor oral hygiene? Well, according to the World Health Organization Global Burden of Disease Study, it's estimated that 3.5 billion people globally suffer from oral diseases, many of which are preventable through proper oral care, diet, access to dental health services. The benefit of good oral health goes beyond our teeth and gum health and could play a key role in disease prevention as well. So the downside is without access to regular dental services, patients are left with untreated inflammation and pain, which increases the risk of periodontal disease and other systemic complications. In turn, the economic impact of unmanaged oral health adds up to an estimated $54 billion in lost productivity. That's a big number. And this is for employers, right? Largely due to absence from work. And that equates to more than 164 million hours of work each year due to dental disease or dental visits. Essentially, this is the cost of poor dental health. Dental diseases have detrimental effects on healthcare systems and societies at large. Providing access to dental care can arguably improve health outcomes, reduce healthcare utilization costs, and improve several societal outcomes. So many oral disease conditions are indeed preventable with early treatment. For instance, dental sealants can prevent 80% of cavities in children. Also, preventive dental care practices, including early and routine treatment at the dentist, combined with good home care, which includes brushing and flossing, can save families money in the long run. These savings can be great for low-income families because they have less disposable income and more preventable oral disease. So studies have shown that for every dollar spent on preventive dental care, anywhere from $8 to $50 can be saved in restorative and emergency treatments. and potentially more in additional types of medical treatment. So it's important to understand that the potential impacts for some start early in life. Early childhood tooth decay, cavities is the most common disease of childhood and often is accompanied by other serious conditions affecting children, their families, the community, and the healthcare system. So tooth decay early in life can be especially impactful for many reasons. According to one study, early childhood tooth decay has been related to impaired development, low educational performance, poor behavior, family stress, diminished quality of life, and even disability and death. The impact on poor oral health affects people in other ways. In fact, according to the ADA report, Oral Health and Well-Being, 38% of people feel life in general is less satisfying due to the poor condition of their mouth and teeth. And that same report finds that in 1 in 5 adults experience anxiety and 23% feel embarrassed due to the condition of their teeth and mouth. Another 1 in 4 adults avoid smiling altogether. Even 22% of young adults avoid social activities due to the appearance of their teeth. So for low-income adults, these numbers are even more sobering. About 35% of low-income adults feel embarrassed over the condition of their teeth, and 29% of low-income adults and 28% of young adults feel like the appearance of their mouth and teeth affect their ability to interview for a job. You know, and people, and that includes employers interviewing job candidates, make assumptions, right? Instant judgments based on people's appearances, including someone's teeth and their smile. People with missing front teeth are often viewed as less intelligent, less desirable, less trustworthy than people with a healthy smile. And here's another sobering statistic. According to the American College of Prosthodontists, 178 million Americans are missing at least one tooth. That's almost half the population. So good oral health not only enables you to function, perform as a human being, and that includes speaking, smiling, smelling, eating. It's also important for communication, human relationships, and financial prosperity. Poor dental health has serious consequences, including painful, disabling, and costly health conditions. So here's a statistic that we at Delta Dental discuss almost on a daily basis. But on average, over 34 million school hours are lost each year because of unplanned or emergency dental care. We could reduce that number by increasing access to dental care. And I find the following statistics extremely interesting because I'm in sales. But 68% of eligible employees enroll in dental benefits when offered by an employer. This is the highest percentage participation rate compared to other non-medical benefits. But it's also interesting to note what percentage of businesses are offering dental benefits to their employees. Small businesses, which make up the vast majority of businesses in not only this state, but across the country, are less likely to offer a dental benefit than larger businesses. And when I mention small versus large businesses, that distinction is really smaller employers, meaning less than 200 employees, and larger employees, meaning more than 200 employees. So I want to talk about regular dental care and how that helps lower healthcare costs. The benefits of getting your teeth cleaned go far beyond dental care. Regular cleanings also appear to help prevent more significant and costly health challenges for those with diabetes and coronary artery disease. A study published in Compendium of Continuing Education in Dentistry researched how preventive oral care impacts the cost associated with care related to diabetes and coronary artery disease. The findings showed that regular dental cleanings and exams translate into significant savings in overall healthcare costs. And interestingly, cost is one of the primary reasons people avoid going to the dentist because many health insurance plans do not include dental coverage. Research has associated periodontal disease, an infection in the gums or the tissues that hold your teeth together, with other medical conditions like heart disease, diabetes, and obesity. Research also suggests that the bacteria behind gum disease can travel throughout the body, triggering systemic inflammation. And when I say systemic, I mean, the entire body. Beyond diabetes and heart disease, a relationship has also been established between poor oral health and pneumonia, Alzheimer's disease, and even cancer. Research has consistently found that oral bacteria can spread beyond the mouth and contribute to other health issues, as I mentioned. The spread of this bacteria may lead to an increase in inflammation, endothelial cell dysfunction, gut imbalances, and immune suppression. As chronic low-grade inflammation is noted in many metabolic disorders, patients with periodontitis may have altered metabolic inflammatory conditions, leading to an increase in systemic inflammatory burden. The same bacteria behind gum disease have been found in plaque associated with heart attacks and strokes. And oral infections can also increase blood sugar levels and make it more difficult to manage diabetes. And uncontrolled diabetes can raise blood sugar in the mouth. The risk of oral health issues also increases with age, as many medications reduce saliva flow, contributing to dry mouth, and that contributes to tooth decay. Aging also comes with a higher risk of gum disease. In turn, research has found that treatment of periodontal disease can lower inflammation and improve other systemic health conditions. A healthier mouth has been linked to less hospitalizations and consequently reduced expenditures. The irony of all of these connections is that the cost is quite often a barrier to dental care, and most insurance plans, including Medicare, do not include dental care. And as a result, many people avoid regular teeth cleanings and exams. By now, I hope you have an understanding that oral care impacts overall health. I mentioned costs prevent people from visiting the dentist. Because it's an added expense, many people just opt out of dental coverage. Data from the Centers for Disease Control and Prevention, the CDC, shows that 50% of adults ages 18 to 64 in the US don't have dental care. 22% of those with dental care coverage didn't see a dentist within the past year. When people retire, those that had dental coverage through their employer lose this coverage. Medicare does not include dental care coverage, meaning dental care becomes an out-of-pocket expense for retirees. The majority of people 65 and older do not have dental insurance. And as a result, many people, especially older adults, skip out on routine care. I want to just qualify that and say that some Medicare Advantage plans do include dental benefits, but there, as I mentioned, are still a large majority of Medicare eligible seniors that just do not have dental benefits. I just want to add that the American Dental Association recommends that people visit a dentist and have their teeth cleaned and examined at least once a year, if not twice a year, and some quarterly, depending on a person's underlying health. Furthermore, regular dental checkups can help find health concerns and intervene early. Postponing care means that oral conditions can worsen, become more expensive, and start impacting nutrition, socialization, overall health, and your quality of life. So with all this, what's the good news? Well, the good news is that individuals are recognizing this correlation and increasingly accessing preventive dental care. In a study circulated by Delta Dental of New Jersey last year, that report found that adults and parents are making oral health care a priority, with more children and adults visiting their dentist for preventive care in 2022 than the year before. According to the Delta Dental Plans Association 2022 State of America's Oral Health and Wellness Report, adults are also following recommended preventive oral care at home, which means brushing their teeth twice a day, flossing, and using a mouthwash once a day, on average. In fact, more than half, 55%, follow the American Dental Association guidelines on how often to replace toothbrushes, while a vast majority of parents, 93%, do the same for their children. Nearly 1 in 2 adults use fluoride products, and approximately 4 in 5 parents believe fluoride is very, if not extremely important in their child's oral health and prevents cavities. So to improve their smiles, and I like some of these statistics, 20% of adults use whitening products, 15% use a tongue scraper, and 10% use either a mouth guard or a night guard. The results of this study were very encouraging. In addition to proactively seeking professional preventive care from their dentist, research illustrates that adults and parents increasingly are doing their own part through diligent at-home care. Yet those with access to further preventive care through their dental benefits programs should take advantage of those offerings. Routine professional care and guidance is critical. A number of oral health services typically fall under the preventive dentistry umbrella, and those include diagnostic services utilized to catch signs of oral problems, such as checkups and x-rays, professional cleanings, fluoride treatments, and even sealants. As a New Jersey-based company, Delta Dental of New Jersey has taken on the mission to educate our communities about that fact and to encourage more regular dental care. And we actively seek to address the issue through our day-to-day business, providing affordable access to dental care, and through direct work in the community. So Delta Dental of New Jersey is headquartered out of Parsippany, New Jersey. So we're right here in our backyard. And in 2022, the Delta Dental of New Jersey Foundation awarded more than $760,000 in grants to support the oral and overall health of communities, providing positive support to more than 14,000 residents in the state. And we're proud to share that information. These programs include bringing dental care to children, seniors, at-risk populations, and veterans, care they would otherwise not have access to, care that addresses overall health conditions to which they also may be exposed. So the Adult Oral Health and Wellbeing Survey, sponsored by Delta Dental, shows that Americans with dental insurance are 40% more likely than the uninsured to see the dentist on a yearly basis. Well, that is promising. So I've spent a lot of time talking about dental care, and now I'm going to change gears and talk about vision care. And we've all heard that our eyes are the windows to our soul, but what do your eyes say about you? Well, just as dental preventive visits impact our overall health, a well vision exam typically helps detect the signs of chronic conditions, along with other eye and health issues. Many people might think that vision care seemingly has nothing to do with oral health care. And again, studies have shown that all medical care is linked, and increases in one area of care can impact others. So I'm going to throw this question out there, but did you know that optometrists are trained to detect numerous health conditions by observing early warning signs in the eyes? So some of the benefits of an eye exam, in addition to ocular issues such as glaucoma, cataracts, age-related macular degeneration, and diabetic retinopathy, eye exams can help your optometrist detect more than 270 other conditions, such as, and I'm not going to name them all, but I'm just going to point out a few: hypertension, brain tumors, diabetes, lupus, high cholesterol, strokes, multiple sclerosis, Lyme disease, aneurysms, thyroid disease. The list goes on and on. Eye doctors often detect signs of chronic conditions before other healthcare providers too. So here are some statistics, interesting statistics, I feel, on why everyone needs vision care. And I'll just preface this, that the stats will show why vision care is more critical to a benefits package than you might think. So 3 out of every 4 adults have a vision correction need. I'm going to repeat that. 3 out of every 4 adults have a vision correction need. That's a very high number. 1 in 4 children have a vision correction need, and 9 out of 10 employees say visual issues affect their quality of work. That's why early detection is critical, and having a vision benefit with preventive care can help detect early conditions so that you can intervene quickly. Another impact to our eyes that most of us on this call are probably dealing with is blue light exposure from digital devices, which can lead to eye strain and fatigue. And 2 out of 3 people in the US are experiencing digital eye strain. Your eyes are probably working overtime from this, especially with coming out of the pandemic and more hours working from home, more screen time, which has, basically taken over. But I'll share some percentages with you. The percentage of people spending more than 2 hours a day on a digital device, this is kind of broken down by generation. So the Gen Xers is 83%, millennials 88%, boomers 88% as well. So all high numbers. But I thought it would be useful to share some ways that you could reduce your blue light exposure. I'm sure everyone is interested in that. So I've included a little PSA for everyone. But in order to reduce your blue light exposure, go by the 20-20-20 rule when using a device. Every 20 minutes, look 20 feet away for 20 seconds. Shut down all devices 2 hours before going to bed. And minimize effects by wearing blue light filtering eyewear. This is anti-reflective coatings, sort of a little secret weapon in the battle against blue light. And also, if you're offering a vision plan, consider adding anti-reflective coverage to your vision plan. So, so what are the benefits of these anti-reflective glasses? Well, besides making your eyes look nice, it enhances your visual acuity, since more of your environment's light is reaching your eyes, and you aren't as distracted by reflections on your lenses. It also reduces eye strain, as I mentioned. Less reflections on your lenses make it easier for your eyes to view small patterns and letters. And AR coating can be extra helpful for people who struggle with reflections on their lenses when doing computer work. So I've just thrown a lot of data and statistics at you, but what's the point, right? Think about times when you have had to forego dental and vision care. All of this is vitally important to your overall health and your quality of life. Having dental and vision care can help address these issues that I've spoken about. The point of all of this is to highlight how these ancillary benefits are a key component to your overall care. You'll need to find a plan that meets your financial needs, but one that also takes care of you or your employees. So what should you consider when offering or purchasing a dental plan? Well, there are several things. Employees desire dental insurance. We've all heard people saying, do you offer a dental plan? Well, it's true. It's the third most requested benefit behind medical benefits and things such as a 401k. Dental insurance is known to impact your employees' overall health positively. Employees with dental insurance miss work less often than those without insurance. Dental insurance can help you control your other group health costs. Employers can often add dental insurance without a substantial cost, and I'll get into that in a few minutes. And dental insurance is a differentiator when attracting new employees and retaining those employees. Dental and vision benefits are good for more than oral and eye care alone. And whether funded as employer-sponsored or voluntary plans, they positively impact the bottom line. Encourage employees to seek care and reduce the number of missed days at work due to emergency care. And what's more, these plans help create a personalized, supportive wellness environment that will aid retention and decrease turnover costs. So remember when I mentioned earlier that around half of the population in this country has at least one missing tooth? Well, Delta Dental of New Jersey does not have a missing tooth clause. You're probably wondering, what is a missing tooth clause? What does that mean? It means that we cover care related to missing teeth. We don't exclude coverage for missing teeth, like a lot of carriers that offer dental insurance do. So this is something to keep in mind when you're looking for a dental plan. So many people do suffer from missing teeth. So employer benefits come in the form of fully insured and self-funded. And depending on the size of the employer, whether you're a small business or a large business, that may determine whether you're eligible for fully insured or self-funded plans. There are also contribution strategies that can be designed with a range from contributory to voluntary. And within those, an employer may pay 100% of the premium or a percentage less than that, or they may pass on all of the costs to the employees. Either way, whatever your contribution strategy is, these plans are employer-sponsored plans, and they provide better rates, lower premium costs, and better benefits than if someone were to have to go out and purchase an individual policy on their own. And don't get me wrong, we offer individual policies. They are great for people who are, let's say, sole proprietors or retirees or someone who's on Medicare. But if given the choice, a group sponsored plan is a better option for all the reasons that I've mentioned. So that's why I would recommend the employer sponsored plan. It's also going to afford less out of pocket, both for the premiums and what employees spend on care. It's important to design a plan or seek out a plan also that offers a rich P&D benefit. And when I say P&D, I mean preventive and diagnostic care. So that includes checkups and cleanings. That includes sealants, fluoride, and treatment for children. The plan should also include benefits for restorative care, such as fillings. And many plans offer orthodontic benefits for children, and some offer adult orthodontic coverage. So offering that preventive benefit is going to encourage people to use the benefits. So you're probably wondering, what's in it for employers? Well, as I've said, a happy workforce is a more productive one. And by ensuring health coverage for your employees, businesses can benefit from better outcomes at work. Additionally, a group health insurance plan includes tax benefits for organizations for paid premiums. And dental premiums paid by employees can be paid with pre-tax dollars, reducing taxable income. Just offering a dental and vision plan is a start, but you want to ensure that you provide education and access to tools for employees so they can make an educated decision on whether the plan that's being offered is right for them. So if you offer a voluntary plan, you want to be sure to educate employees on the benefits at your open enrollment period. And this will encourage optimal enrollment in the plan. I'd recommend providing notice so that employees can engage their spouses. Many women are the decision makers when it comes to benefits choices. And if there are two dental plans that are offered to a married couple, each through their respective employers, they will want to make the best decision for their family and choose the best plan for which they want to enroll. Becoming eligible for group coverage may also disqualify someone for an individual dental plan. So this is another reason you want to make sure that everyone is aware of the benefit offering and what those benefits include. So create a plan that employees will use and seek out, and a plan design, as I mentioned, that encourages that preventive care and also comes with little to no out-of-pocket costs. Delta Dental can help you with all of your dental and vision benefits needs, whether you are a small, a mid, or a large size business, or a sole proprietor or a retiree. And with that, I will close, and I hope you found this information presented today informative. And I'd like to thank you for spending this time with me today. And what I'll do now is I will open it up to any questions.
Hi, Karen. Thanks so much. We did have some questions come through.
Okay.
So the first question is, do you have a recommendation on the brand or where to buy anti-reflective glasses?
So I do not have a recommendation on a brand or where to buy, but I do believe that at your, whether it's going to be an online retailer or the, where you go to purchase your glasses, numerous different retail outlets, I think they will all be able to provide you with that anti-reflective coating.
Great, thanks. Also, what % of people don't have dental insurance?
77 million adults do not currently have dental insurance.
Wow. Okay.
Yeah, that's a high number. Actually, I'll add to that. 3 times more adults lack dental insurance than they do medical insurance. So there's a lot of opportunity to improve access to care.
Okay. And how many people get medical coverage through their employer?
So the number of people that get health insurance through their employer, that sits around, it's just under half of the population of the US. So 150 million, something around that. That's the number.
And why is early detection key when it comes to diabetes?
So that's a great question because I talked a lot about diabetes in the presentation. It's because early treatment can prevent serious complications. When there's a problem with blood sugar, doctors and patients can take steps to prevent permanent damage to organs such as kidneys, eyes, blood vessels, the heart. So you really want to try to, get out in front of that. And that's one of the reasons I mentioned the A1C program, the testing that Delta Dental has, been a big proponent of.
Okay, thank you. Are there any other questions? Because that looks like the only questions that have come in. So if you have any other questions, feel free to put them in the chat. So until then, I think that's all we have of questions. Do you have any last words or thoughts for us?
No, just thank you for having me today. And I hope that, like I mentioned, I hope this was time well spent for everyone who joined us today.
Yes, it was a lot of great information. Thank you so much.
Thank you.
So don't forget that you'll be receiving a copy of the recording from today's program via email. It should come sometime, probably next week. And join us for our next webinar, which is how will the New Jersey Secure Choice Act and Federal Secure 2.0 Act affect you? That is on February 16th. And to register for that, you can visit our website at njbia.org. So until next time, for Karen Hepp and Delta Dental, this is Amy Music, thanking you for being with us today and wishing you a great afternoon and weekend.